6 years ago, Conservatives promised to reduce healthcare wait times, but this promise, like so many others, has been broken. The Wait Times Alliance report shows that wait times are now on the rise. This on top of the Conservatives' unilaterally imposed funding formula, which shortchanges provinces and territories by over $30 billion. So can the minister explain why the Conservatives have broken their promises and failed Canadians so miserably on health care?
Hear, hear.
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, we've made progress working with the provinces and the territories on wait times, but there is obviously still room for improvements in the healthcare system. To help the provinces and the territories make even more improvements, we're increasing the federal health transfer funding to record levels, reaching $40 billion by the end of the decade. More than that, Mr. Speaker, we're investing significantly in health research and innovation that we hope will help people avoid the hospital altogether. Thank you, Mr. Speaker.
The Honourable Member for Vancouver East.
The minister knows that our health system is in need of reforms. Reforms to provide services like home care, like long-term care, reforms to provide cheaper and more accessible medication, all things that her government committed to in the health accords. So can the minister tell us what she plans on doing now about rising healthcare wait times, or are her government's commitments made in the health accords not worth the paper they're written on?
Hear, hear.
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, as I've stated before, with working with the provinces, we have increased transfers to the provinces, which the Liberal Party cut it back in the day. Mr. Speaker, the $40 billion will be invested in areas of priority by the provinces and territories. In addition to that, Mr. Speaker, we have made significant investments in areas of health research, in Aboriginal suicide prevention, in physical activity, in tobacco reductions, in diabetes, and much more, Mr. Speaker.
The Honourable Member for Dufferin-Caledon.